Hello, this is the American Medical Association's COVID-19 update. Today's the first episode in a week-long series focused on residents and COVID-19, part of AMA's Resident Recognition Week, to recognize residents for all they've done through the pandemic and continue to do for our country. We're kicking off the week by talking to three resident and fellow leaders, Dr. Megan Srinivas, an AMA section delegate and infectious disease resident in Fort Dodge, Iowa, and Dr. Scott Pasichow, an emergency medicine fellow at Brown University and the outgoing speaker of the AMA Residents and Fellow Section Governing Council in Providence, Rhode Island, and Dr. Brianne Standifer, a member of the AMA Ambassador Steering Committee and an internal medicine resident at Henry Ford in Detroit. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Each of you chose to become a physician long before we had ever heard of COVID-19. I'd like to talk to you about how the last few months have either reinforced or changed your reasons for practicing medicine. Dr. Srinivas, why don't you start us off?
Oh, sure. The biggest reason that I entered medicine was because of the issue of health equities and trying to fight for a system in which disparities could be overcome rather than just trying to overcome one case at a time. And in the setting of the pandemic, it's really just exacerbated the inequities that we see, whether it's racial disparities, whether it's rural versus urban disparities. The inequities have just become larger and larger and shows that this work is so much more vital than it was before.
Dr. Pascal?
So I became a doctor because I wanted to be there for people in their time of need. And I wanted to try to meet people where they are and help them to engage in good, healthy behaviors and take care of their sick loved ones and take care of themselves and try to have a better life in the future as well. And certainly during the pandemic that has changed, or the way that happens has changed, but the desire to still be there for people and to help people has stayed the same. My hospital's been great at getting iPads into the hospital so that we can have family discussions, even though we need to be physically separated. And that type of adaptation has been great and has really reinvigorated my desire to be there for people.
How about you, Dr. Standifer?
I think similarly, I became a physician because I wanted to help people. People come to the hospital in their most vulnerable times. This is something that we've seen pre-COVID and even more so during COVID. And it's been a pleasure to be there for people at their greatest time of need.
Okay, this is a little bit of a lightning round. I'd like to ask each of you, what is one key thing that you've learned through your residency you'd like to share, and one thing you'd like to change? Dr. Pasichow, why don't you start?
So one of the things that I think we learned as we went through this was messaging and how to communicate with the public in a way that gets behavior change and gets people to sort of act the way that we're looking for. So in the beginning of the pandemic, we talked about, we're here or we're here for you, stay home for us. And that was important for people actually staying in their houses and not gathering in social settings like they were used to doing to keep people safe. And in some ways that has felt like it almost became stay away from the hospital. And that really wasn't the message we were looking to send. In Rhode Island specifically, we worked on changing that messaging and reminding people that heart attacks and strokes are still happening. So that's something I've taken away from this pandemic and from my time in training that will definitely be useful going forward.
I'd like to follow up a little bit about that. Before we started recording, Dr. Srinivas, you and Dr. Pasichow were talking about adjusting your communication styles to get behavior change now that we're in the phase we are with the COVID pandemic. Can you talk a little bit about how you're communicating to get that desired effect?
In the world of medicine, we get so locked into our jargon and thinking about numbers and the scientific method and physiology, the way that we view medicine. But when we're trying to communicate to the public, we have to relay it in a way that they can understand, and that just not only is comprehensible, but that actually motivates them to want to make the right change. And that has been such a key evolution during this pandemic, as we've seen more and more people in the realm of medicine and science really crossing over into this public health advocacy, something that unfortunately had really been lacking in the past, but the pandemic has been really good at encouraging and bringing about.
Any other thoughts, Dr. Standifer or Dr.
Yeah.
Pasichow?
Really meeting people where they are. That's the unique thing about myself. I'm from Detroit and working in my community. You have to learn how to meet people where they are, find out about them, what struggles they have, so that you can build that trust to begin with. And then leading on that trust, you're able to spread these messages of stay home, don't come to the hospital. Wait, no, come to the hospital. So it's kind of like a trust and meeting people where they are.
Dr. Sanford, while you've got the mic there, can you talk about one thing, key thing that you've learned and one thing you might change coming out of your residency?
I think one thing I've learned in medicine and in residency, everything is about rules, guidelines. What are the new guidelines? What are the new guidelines saying? And COVID has taught us, and it's been amazing actually, because there are no guidelines. And we are relating to our physiology in med schools to kind of guide us to what we're doing now. And I think that having that thought process and not always being strict to guidelines is what we need right now, because things continue to change, especially coming post COVID, how you screen a patient to go to a COVID side versus a non-COVID side. We have to change constantly, and it's not a strict guideline as we are, thought to be as physicians. We're so strict and rigid with our thinking, and we have to be able to become fluid and evolve quickly. So as far as what I change is kind of encouraging fluidity. Like, you don't have to be so strict. It's okay to move and change from day to day.
Well, we have a whole new group of folks entering their residencies. Dr. Standifer, what's one key piece of advice that you would give those folks?
Man, just come in every day, give it your all, leave it at the hospital, and then come back the next day a new person. Don't ever let what you came in and what affected you that first day go into the next day, because every day literally looks different.
Dr. Paschal and Dr. Srinivas, what's your piece of advice?
I think getting to know the people that you're working with is really important. And it's not just the residents, supervising residents or the attendings that are training you. It's the nurses, it's the techs, it's everyone in the hospital that is part of training you to become a good physician. So get to know them a little bit, become friends with them, because when you need them, they're going to be there for you. And that's going to be really key to great patient care and learning how to practice medicine.
Dr. Srinivas?
I would agree completely with that. The biggest thing I learned in residency and fellowship was really that medicine is a team sport. And it's about knowing that even at 2 a.m. in the morning, you have a whole team supporting you if you hit a tough obstacle or a patient that you just don't know what to do. And you can come together and really discuss it and make sure that you're going in the right direction. You're never alone. And showing that you're willing to reach out to others, regardless of level, like Scott said, sometimes the nurses in the NICU know so much more than a trained doctor of many years because they've seen this, and vice versa. So it's really about working together with everybody on your team and trying to collaborate. And you're never going to have to face that obstacle alone to do that.
Well, you've all been leaders at the AMA, and I'd like to ask you about how you've used your leadership roles to elevate the concerns and issues that are important to residents. Dr. Paschal?
So some of that's really just been listening to what people are telling me about, and seeing the struggles that I've had and that I've experienced, and relaying that and sort of talking about that to either my resident leadership or the hospital administration, or bringing some of that stuff to my national specialty society, or the AMA or the state medical society. But it's really just listening and seeing what's going on and thinking about how can we make that better, whether it's telehealth access for individuals, or making sure that there's good mental health access for healthcare providers while they're struggling to deal with our changing environment.
Dr. Standifer?
So we did a couple of things. The first thing was we noticed that everybody in the hospital was getting surge pay except for the little residents. So we had a conversation with our chair, and we were actually able to make some headway and actually get some sort of surge package. So that was really nice because people didn't want to say anything. And I was like, well, why not? Let's just ask. And so we got it. And that was really nice. And I think the second thing was just from a mental health standpoint of everything, seeing patients die, 8 patients in 42 hours is very traumatizing for anybody. And so I noticed that we needed something to boost our morale. So I went to our program director with the idea to have a t-shirt contest to design for internal medicine residents. And it allowed our creative co-residents to kind of showcase what they can do. And we were able to get these nice t-shirts funded by the program. And we wear them very proudly.
Dr. Srinivas?
One thing about being a trainee is you go into a world that you hadn't really been exposed to before, sure, you've been in medical school, but you're suddenly 24/7 taking care of patients and living their stories with them. And you see the holes in the system. You see what's impacting the way people can take care of themselves and impeding their ability to do the right thing even if they want to. And that's when you really get motivated to want to help change those things, to help those people that you now care about have a better life. And in seeing those goals and feeling that motivation, my residents, my co-residents and I, we really wanted to get involved in changing the system. And the AMA has enabled us to bring that message, bring what we saw, and get involved in advocacy in a way that we wouldn't have been able to before. And that's truly been one of the most empowering things being part of the AMA.
Well, Dr. Standifer, we've talked a little bit about residents using their voices to make change. Why is it so important right now for them to use their voices in medicine, and how do they go about doing this?
I think not being afraid to say and speak their feelings. Of course, talk to your co-residents first and kind of, hey, is this too much? Am I being a little aggressive? No, yes, okay, cool. So I think kind of using your peers to help you make a blueprint of what you want to say, and never being afraid to just ask the question and put your voice out there, because a lot of these hospitals, as you spoke earlier, Dr. Megan, we work as a team, and residents are one of the core parts of the team. And I think being okay with asking the question and voicing your opinion and letting them know how you feel is very important, especially day one.
Yeah, I just to piggyback off of that, I've always said if you're not at the table, you're on the menu. Right now people are really paying attention to what we're doing in healthcare, and the sacrifices that we make to take care of our patients. So it's a really great opportunity for us to talk about some of the things that can really make our lives easier and make it easier for us to provide great patient care for our patients. So now is definitely the time to speak up and to make sure that you have a seat at the table, and that the decisions that get made with your input, so that we're not stuck with policies that we don't like.
Dr. Srinivas, I follow you on Facebook. I'm seeing you use your voice. Can you talk a little bit about why it's so important and what's happening with you in Iowa right now?
Yeah, despite being still an infectious disease fellow and board certified, but still in the research track, despite being a fellow, I have enough knowledge and realizing that I can really be a voice to create change and positive change. One of the big issues that we're seeing in my state is a lack of appropriate messaging as to what should be done, and constant contradictions from our leaders at the state, the local, and the national levels, which is leading many people in my local communities and actually throughout Iowa being confused. It's causing them to be very confused as to what they can do to protect themselves, the community, and what really is the right thing to do. Being a physician, we have a designation already in society where people want to trust us a little bit more than the average person. So using our knowledge to spread what we know based on evidence, based on experience, is one of the biggest things that we can really do to help the community. And that's what I'm trying to do. Just trying to get the right message out there and answer questions from people when they voice confusion. So we can hopefully get people wearing masks more frequently and hopefully stop the transmission before it gets even more astronomical than it has been.
Well, last question, Dr. Pazichow, why don't you start? What's the one thing you'd like to see better support residents and fellows as they develop their clinical and leadership skills?
I think we're starting to work on it, but I'd like to see a better access for mental health care for us. I think there's a stigma that comes along with seeking help when you need it, when you're not feeling like yourself and you're not feeling like you can take the best care of your patients as you need to. And licensing questions that may look at, the fact that you had worked with a counselor in the past and may try to limit your ability to practice in the future because of that. Those are the things that the Federation of Medical Boards is recommending that we don't ask. If it doesn't affect your ability to practice medicine, then it's not something that we need information about when you're going for a licensure. So making sure that the rules are in place so that residents don't feel like asking for help in their time of need is going to prevent them from ever practicing medicine again.
Dr. Standifer, how about you?
I would totally piggyback on that as well. I think particularly with us as second year internal medicine residents, well, almost third year in a couple of days, applying for fellowship, what does this look like for you? Like, how does my application, how is it effective? Because you have people who wanted to do oncology, for example, who were pulled from their clinic responsibilities in the oncology department to come help with the GPU or general floor in the ICU, and they lost that face one-on-one time. And so you have residents who are fearful of their careers as COVID has happened. And I think normalizing it being okay to be stressed and having a plan and being vocal about those things, I think to make us all feel like one and not just robots. I felt like a robot. Nobody ever asked, how are you doing today? It's no, there's a new patient, go see it. There wasn't a lot of, are you okay? Are you okay? We didn't get a lot of that. And we just didn't have the time to do it because the volume was what it was. So I think the mental health is so, so important.
And Dr. Srinivas?
I have to agree completely. There are so many things that we can talk about, but I just have to reiterate what Brianne and Scott said. It really comes down to feeling supported and that mental health aspect of it. We go through so much in residency and fellowship, and not just because of the emotional roller coaster you're on for what you're seeing, but even just the hours alone and what's expected of you in this perfect image of what it truly means to be successful in medicine, which is the image that we've upheld for decades. But we need to show that that's not true, that we are human, and that understanding our humanity actually makes us better at our profession. There was one professor I had my intern year who made such a difference. And honestly, I will remember this moment for the rest of my life because it truly impacted my humanity in medicine. As an intern, you're expected to take anything. Whatever the patient says, it's your fault. And I had one patient that was massively mistreating me and my entire team. And I was taking it because I thought that's what I had to do. That's what's drilled into you. The patient's always right, kind of like in customer service. And this professor one day just walked into the room. She was my attending at the time. And she just stopped the conversation and said, "You are mistreating my team. They don't deserve to be treated this way. You can choose to get care here by treating us respectfully, or you can choose to leave. I will not allow anybody to treat my team this way." And that meant so much to me. I don't think she even knows how much that meant to me. And I will forever carry that with me.
Wow, what an important lesson. Dr. Srinivas, Dr. Pazichow, and Dr. Standifer, thanks so much for being here today, sharing your perspectives and kicking off our Resident Recognition Week. That's it for today's COVID-19 update. We'll be back tomorrow with another segment. For updated resources on COVID-19, go to ama-assn.org/COVID-19. Thanks for joining us and take care.